What is leukemia? That's obvious, right? It's cancer. But then, what's cancer? In a nutshell, cancer is a disease that is caused by uncontrolled and a rapid division of cells, by a mutation in the cell. These cancer cells are very dangerous, as they consume most of the body's energy and resources. Now, back to our topic. What's leukemia? Leukemia originates in the bone marrow. Where is the bone marrow, you may ask? Well, that's simple. So, first of all, let's draw a bone. So, here, right here, that's our bone right here. And so, now this is the bone. Now you may think the bone is opaque. This is full bone, there's nothing inside. Well, actually, in a bone, there's this cavity inside the bone. Now, what that cavity is actually the bone marrow. So, if I was to look at a bone, so imagine this is the bone right here in my pen. And if I look at it like that, this is what I would see. So I would see the bone, and inside the cavity. And this cavity right here is the bone marrow. Now, how is the bone marrow so important, right? It just has no purpose right now. Well, it has a very, very important purpose. Because inside the bone marrow, there are white blood cells, red blood cells, and platelets made. And these platelets then eventually, when they're developed, they go to the blood. So, imagine this is the blood right here, in the liquid form, as you would probably see it. And so this would eventually go in the blood. And now, so what happens in leukemia is that one of these cells has a mutation, and it, just apparently keeps on dividing itself. So, this is what a normal blood marrow would look like. But after a person has leukemia, or during the person has leukemia, this is what it will look like. It's just filled with cells, the cancerous leukemia cell. And when that happens, what happens is that these will leak. There's actually the cancerous leukemia cells will leak. So, you have these cells leak into the blood. That is very, very dangerous. So, you have a lot of cells in the bone marrow. But what's the problem, right? The more cells are better? Well, these cells are different. They are worse than useless. See, if you have a normal cell, so this right here, imagine this right here, is a normal cell. Now, a cell matures over time. So this would be an immature cell. Here, this is an immature cell. And so this is the cell right here. This is a nucleus. And so in an immature cell, the DNA will be scattered, so not organized. So we just like that, probably the DNA. The nucleus is very big compared to the cell size. Now, eventually, the cell will mature. So, this will mature. So the next step, it will look more like this. So, it will get smaller. So it'll look more like this. And so that's what basically how it matures. And so when it matures, it can perform tasks. So it can do what it's supposed to do in the body. However, in a cancerous leukemia cell, so imagine we have a cancerous leukemia cell right here. And so how does it mature? Well, it's different than a normal cell. This is the immature cell. And that's it. No, that's stop. It does not mature after that. That's the first step. So it will be immature. All leukemia cancer cells will be immature. They will never mature. So, and these cells have a special name. They're called blast cells right here. They're called blast cells. And so, what eventually happens is these useless cells, they're not useless, will overtake the bone marrow. So, it's already got a lot of cells, but it will eventually overtake the bone marrow. So now there'll be way more cells, way more leukemia cells, cancerous cells. And so, what these will do, they will eat up all the body's resources. So most of the resources that go into the whole bone marrow will go to the cancerous cells. And so in a leukemia patient, so if you see a leukemia patient, you will see they have very low white blood cells, red blood cells, and platelets because these cancer cells are taking all the resources. And this is what makes leukemia such a deadly disease it is. Okay, so how dangerous? Well, here is a leukemia patient. What would be his symptoms? Well, you'll often see fatigue and weakness, bone pain, and excessive sweating. But those are just some of the symptoms. What are the other symptoms? Other symptoms will include this right here. So, other symptoms will include weight loss, fever, frequent infections, shortness of breath, muscular weaknesses, pain on the bones and joints, fatigue, loss of appetite, swelling on the lymph nodes, and enlargement on the spleen. So, this right here is actually the spleen. So, as you can see, this section right here is a normal spleen, but this enlarged, see how big it is? That's what happens when you have leukemia. And so, how dangerous is it? What is the survival rate? Well, in leukemia, first of all, how many people get it? So, in the US alone, there's 40,000 people that get leukemia. How much of them survive? 60 to 70% of them survive. So, yes, leukemia is a very dangerous disease. As all cancers are, leukemia is a very deadly disease, and the treatment is rather sketchy. If you're a curious person who would like to know more about the treatment of such a deadly disease, make sure to watch the next video, which will be out in a few weeks. Also, don't forget to like, subscribe, and share. Thank you for watching.